अपने आप से।
हेलो। हेलो। हेलो।
Hello everyone, good evening. All are there? Okay. So we'll be starting the session within next 2 to 3 minutes. So kindly guys have patience. So stay on the meet. Within 2 minutes, I will be starting the session. So, hello everyone. Very good evening. So, I hope everybody has been present over there. So, we are going to start the webinar regarding your medical coding. So, during the session, you can use the chat section and to interact among yourself. Yes, I have turned my video on. Just check it in the chat section. Okay, sure. So just I will be sharing my screen. So during the session, you can use the chat section to interact with me, and you can use emoticon sections as well to interact with me. Okay. Otherwise, if you want to ask any question, then directly you can unmute yourself and talk to me. Okay. So just a minute, I'll be sharing my screen. So give me a moment, I'll be sharing. So today we are here to discuss about the medical coding. So the very first important I will be starting with what is medical coding? Okay, what is medical coding? So medical coding is nothing but it is a process of translation or transformation. Okay, medical coding is nothing but the translation or transformation procedure. But the thing is, what are the things you are going to translate or transform? Okay, all the healthcare diagnosis, disease, and the reports, then your medical test, all the equipments that is been used in a medical setting, everything has to be converted into alphanumeric codes. So this is known as medical coding. So what is medical coding? Medical coding is nothing but it is a process of translation or transformation. All the healthcare diagnosis, disease processes, all the test results and equipments has to be converted into a universal alphanumeric codes. Universal alphanumeric codes. So how you will be converting this codes? How, where the codes will be available, we'll be discussing in further slides. Okay. So before that, I will be telling you what is the need of medical coding. Okay, this is coding. Why we are converting things into codes, that is fine. But why do we need the coding process? Why it is important? Okay. So because suppose you are here we will be talking about the world of healthcare system, the global healthcare system we will be talking about. So here what happens whenever a patient visiting to the hospital, after receiving all the treatments, they won't be paying in cash. So how the payment system will be working on? Through the insurance. Okay, they'll submit their insurance and the insurance company will be paying the physician and the healthcare professional. Then why we need coding? Again, the question is, so medical coders are responsible for developing the alphanumeric codes. Okay, right? Then the patient insurance data will be created by using this codes. So why the codes, where the codes will be useful? The patient insurance data will be created by using this codes. So that's why we need the medical coding. Because if you convert the 100 pages of codes into some 5-7 codes, 100 pages of reports, okay, 100 pages of reports, medical reports into 5-6 number of codes, then it will be very easy for the insurer to make the payment because every code will carry a dollar value. Okay, because every course will carry a dollar value, particular dollar value. So coders are responsible for somebody's payment. So that's why this job is very much crucial and confidential as well. Okay. So next the thing is this, what is medical billing? Okay. Medical billing and medical coding, both are different. So in further slides, we will be talking about medical billing. Next, we will be talking about benefits. What are the benefits out of this coding? So mostly I have told, as a coder, mostly you will be working for the reimbursement process. But apart from this course will be utilized in resource utilization, clinical care, research, education, sample test. In all the sectors, it will be useful. Next, what are the types of coding? How many types of medical codings have been present? Okay. So during the training session, we will be learning three types of medical coding. What is that? ICD, CPT, and HEPICS. So these are the three books, or you can call it as a manuals, or you can call it as the three types of coding which you are going to study in the entire training process. Okay. So apart from this three book, one more book you will be studying, that is your language of medicine. So during your, to be a coder, your journey will be with the four books. What is that? First is ICD. ICD stands for International Classification of Diseases. CPT. CPT stands for Current Procedural Terminology. And HEPICS, that is your Healthcare Common Procedure Coding System. Okay. So these are the three books. And one more book I have told you. What is that? That is your Language of Medicine. So language of medicine is very, very important book, because at first from that book, you will be learning the medical terminologies. What you will be learning? The medical terminology. So what is medical terminology? Medical terminology is nothing but the process of study of medical terms. Okay, the process of study of medical terms. So what are the medical terms? So a lot of words you can see: gastroenterology, appendectomy, then lot of words: hematology, cardiology, cardiomegaly. So these are the simple words you know, and you have studied, so you know. But there will be a lot of complex words in the medical reports you can see. So how to identify those words, how to break those words, how to identify the meaning, how to remember this. So this all you will be you will be getting into the training. Whenever you will be learning, whenever you will be getting into the training. Okay, so that is the very first thing as a coder you have to understand. Then the second thing is human anatomy and physiology, like your integumentary system, musculoskeletal system, respiratory, cardiovascular system, then your urinary system, reproductive system. So this all systems should be very, very clear. So first we do teach the medical terminology, then human anatomy and physiology we will be starting along with the CPT book. So one chapter of your human anatomy and physiology, and one chapter of your CPT book we cover like that. Then we can go for HEPICS. Then finally we can go for ICD. Okay. Now we will be talking about one by one book, what kind of course will be available, what is this kind of course that we will be talking about. So first book I have told you, Language of Medicine. In that, what you will be studying? The medical terminologies. If you complete 4 chapters of the medical terminology, then you will be a proficient in medical terminology, to learn the medical terminology. At least you should be very much thorough about the first 4 chapters. Okay. Then, in that Language of Medicine, the basics of human anatomy and physiology will be there. So that has been completed. Next, we will be talking about ICD. Okay. So during the session, whenever you feel doubt, you have a question or anything, directly you can ask. Okay, directly you can unmute yourself. You can ask. No need to wait for that. Okay. So at least after sometimes, if you have any queries, if you don't want to ask directly, you can put it in your text in the chat section. Okay. So next is ICD. What is ICD? ICD stands for the International Classification of Diseases. As you can see, diseases means all the disease diagnosis, their causes, reasons. These kind of codes will be available in this ICD book. So who published this ICD? WHO published this ICD. Okay. Suppose disease code, like you will be thinking what kind of codes will be available here. So if I can give some example, suppose you will be searching a code of HIV infection, COVID-19 infection, Zika virus infection, or diabetes, hypertension, or you can call it as like any heart diseases, anything. Okay, anything you, any disease and diagnosis code you are searching. So where you have to come? You have to come to the ICD book. Okay, so there you will be getting the all the codes. So how many chapters will be there in ICD? 22 chapters will be there. For your certification purpose, 5 chapter will be important. Okay, no doubt you will be studying 22 chapter, but in your CPC certification examination, only 5 marks you will be getting from the ICD book. And only 5 chapters are important. So ICD coding is very, very easy even. So next I will be talking about CPT. Okay, CPT. So what is CPT? So to remember the each book full form, that is very, very important. Okay. And one more point I just missed, that is your ICD 10CM. The full book name is ICD 10CM. What is 10CM? 10CM, it stands for 10th clinical modification. It stands for 10th clinical modification. So what is 10th clinical modification? In the sense, 10th time this book has been revised. 10th time this book has been revised. Okay. Next, I will be moving for the second book, that is your CPT. Okay, CPT. So CPT stands for current procedural terminology. And you can see the name procedural terminology. All the procedure codes will be available in the book. All the procedure codes. And who published this CPT? AMA, American Medical Association. In the year of 1966, this book has been published. That means from the year 1966, the coding has been on existence. Okay. And this CPT book, like as you can see, the procedural terminology, procedure in the sense, for example, any surgery has been done, any biopsy has been done, any wound exploration has been done, any drainage has been done. So this all codes you will be getting in CPT. For example, appendectomy, gastrectomy, nephrectomy, CABG surgery, any heart transplant, lung transplant, any biopsy they have done, any repair they have done, any wound exploration they have done. So physician, whatever procedures has been done on a patient, those all procedure codes will be available in your CPT book. Okay. And this in this CPT, so just somebody is scribbling on the screen. It is some name I can see. It starts with R. So please don't scribble on the screen, anyone. Okay. Next. So how many chapters you will be going through the CPT? 6 sections it will be having. 6 sections, 6 chapter, but only surgery sections will be having a lot of division. Okay, some 10 chapters will be there. Almost some 15 chapters you will be studying here. Okay, 15 to 17 chapters. Next, we will be talking about HEPICS. So at the end of the session, I will be showing a few examples of the course. So if you really want to go through the course, I'll show you. So first I'll be explaining the brief description and the introduction part. Then finally, we will be moving for some code examples. Okay. So you have to wait for that so that I can show you some code examples. So next book, we will be talking about HEPICS. HEPICS stands for Healthcare Common Procedure Coding System. So what kind of course will be available here? Some procedure codes, which is not available in CPT. Apart from that, some supplies, goods, services code will be available in this HEPICS book. So this HEPICS book mainly known for the equipment coding. It is known for equipment coding. So equipment, for example, suppose you are finding code for wheelchair, walker, weighing machine, oxygen cylinder, any artificial prosthesis, any lens, whatever the medical equipments that has been used in a medical setting, any syringe, anything, any instrument, okay, any public transportation the patient is being used. So the transportation services, that cost also will be covered by this codes. Okay, so medical coding, what? Everything has to be covered, every amount has to be covered in the under the insurance. So that is our main concept. So I hope this three types of coding has been clear to everyone, ICD, CPT, and HEPIX. Please give a thumbs up, everyone. You can type yes in the chat section, or you can give a thumbs up. You can use your emoticon sections so that I can understand you people are active, you people are listening, you are getting me. Okay. So I hardly can see 3-4 thumbs up. What about others? All are active? Yes. Okay. Thank you for the response, everyone. Okay. So next we'll be talking about application of medical coding. As I have told, as a coder, what will be your application? Your application will be on the reimbursement process. Okay, to get the payment from the insurance company for the patient or the hospital or for the physicians. Okay, so mostly your application as a coder for the reimbursement, but apart from that, this course will be utilized in statistical analysis, then decision support system, surveillance, evaluation process, internal and external quality management. So mostly you have to understand the reimbursement process. Other procedures are not for you. Okay. Next, medical coding process flow. Process flow. Process flow in the sense how you will be working as a coder. How you will be working as a coder. So as a coder, per day, you will be given some chart, some 10 charts, some 20 charts, some 5 charts. It depends on the length of the chart. It depends on the length of the chart. So it can be 100 pages, sometimes it can be 50 pages, sometimes it can be 30, 40, it can go beyond 200 pages. Okay. So based on the length of the pages, you will be given reports, charts. That is, you can call it as a medical charts. So your work is to read all the charts and convert it into the codes. Correct? Convert into codes. Suppose you have done your work. But how you will be doing the work? In the training session, you will be using hard copy and soft copy of the book ICD CPT HEPIX. During the training, you will be using hard copy and soft copy, and one open software will be given to you. Okay. That is open software. Anyone can access that one. So that will be given. But when you will be moving to the working field, there they will be giving you some protected softwares. What will be given to you? Some protected softwares. So on that protected softwares, you can access the every code very easily. Okay, so that within a very few hours you can complete your 3-4 charts, 5, 6, 10 per day. It is very easy to solve the charts, and it is very interesting as well. Okay, so you have now you have converted. Okay, you have given the charts, you have converted into codes. Now what? Now you will be process the data. Suppose you have coded something, it doesn't mean they will accept. So there will be a quality team, there will be a review team, your work will be verified, then only they'll accept it. So every time you have to maintain a accuracy of 90 to 95% of accuracy of coding. Okay, so this is what you have to do. And finally, when it will be accepted, then only they will be submitting to the insurance company. Okay, through the medical billing system. Okay, so now the role of the biller comes into the picture. What is billing system? Why the billers is important? And do medical coding and billing is the same department or not? That we will be clarifying. So very first question, is this two domains are same? No, these are not same. These are different departments, and the work is completely different in the sense coders will convert the data into codes. That's it. After the completion of the work of a coder, the billing process will be starting. Okay, the billing process will be starting. So the billing process, how it will be working, So the process of creating medical claim to submit to insurance company in order to get the reimbursement for the medical services that has been provided by the provider is known as the medical billing. Okay. So through this billing, why we need a biller? Because what the biller will be doing? The converted codes they will be submitting to the insurance company, and after submitting they will track all the claims, whether the payment has been done to the particular physician, particular hospital, or particular patient is been done or not. So when the hospital side claiming the insurance, the hospital side will get the payment. But when the patient spend the amount and finally they have claimed the insurance, the patient has to get the reimbursement. Okay, so this is the entire process. So this medical biller plays a bridge between the insurance and the receiver, the provider and receiver side. Okay. And if you talk about a biller or coder, they plays a very, very important role in the revenue generation of any country. Okay, they plays a very, very crucial role in the revenue generation. Okay. So regarding billing, I'm not going to in detail. So roles of the medical coder already I have explained. But apart from that code conversion, everything, what a coder has to do, a coder should be like pre-check all the paperworks. Any paper gap has been there, any paper has been missed, all the process are clear or not. Everything a coder has to check. Okay. So it is not from the day one can be a subject matter, but suppose you are working for 6 months, 1 year, 2 year like that. So after that, you should be a very much like a subject matter expert, because every company need an expert. Okay. And you should be a very good resource for the other coding professionals. You should be a subject matter except expert, and you should be a very good resource for the other coding professionals. Okay. So these are the things you should have. So this is all about our book knowledge. Now we will be talking about something different. What is that? Skills. Okay. So you learn ICD, you have a human anatomy and physiology, medical terminology, everything Okay, how to fetch the code. So in medical coding, what is the very important thing? How to fetch the code. Okay, your logic, nothing you have to remember. Only human anatomy and physiology, except that nothing you have to remember except a few guidelines. If you are spending 3 to 4 months, definitely if you don't want to remember, still you will be remembering at least 50% of the data. Okay, because you will be spending some time, your trainer will be teaching you. So in this process, everything will be like at least 50%. If you don't want also, you will be remembering. So this is all about our big book knowledge. So next we will be coming to some other skills, what a coder must have. So other skills in the sense, it is kind of your soft skills. So what is that? Administrative writing skill, reporting abilities, organization skill, record keeping, Microsoft Office proficiency, professionalism, confidence, planning, verbal communication. So these all are very, very important. So I must tell most of the students to work on the verbal communication and confidence and planning. So this is the very basic thing. Okay, one is verbal communication, then planning, then confidence. These three things are very, very important. So these are nothing that big skill you can learn very easily. So I do tell people to interact with the session. Whenever you are joining session, you should interact, you should raise your question, you should raise your queries, you should able to talk to people. Okay, then only this confidence will be there. Okay, you will be outspoken. So this kind of quality coder must have. Okay. Next, the very important part we will be talking about, what should be the minimum qualification should have as a coder. So officially, if you are an intermediate student, if you are an intermediate, you have completed your plus two, you can pursue this course. Okay. But some companies, they need the degree holders. It depends on the company, like what qualification they need. But you will be on safer side if you are a degree holder. Okay. Degree in your pharmacy, nursing, MBBS, or any life science graduate, your botany, zoology, physics, chemistry, anything you have done. But you must be a graduate. Okay. In life science or non-life science, because I have seen many candidates, they belongs to B Tech, M Tech field. they also pursue this course, and they are hired, and they are right now in a very good position. Okay. So any kind of life science, non-life science, medical, non-medical, nursing background, anybody can pursue this course. Okay. But you have to learn, you have to be into the entire training process. Okay. So once you will be trained and certified, then the opportunities will be very, very high. So you must be a degree holder, degree in pharma, medical, nursing, life science. So these are, I have told you. Apart from that, if you do have any experience, so you have to show the experience so that they will be given preference to you. Okay, they will be given preference to you. Next. Next, we will be talking about career opportunities. Okay, so career opportunity in the sense, whenever you are looking for any kind of job, okay, whenever you are looking for any kind of job, the very important thing is you look for salary. What do you look for? You look for salary, right? Salary in terms of the salary should be a, like, at least at the starting you must get some good packages. Okay, at the starting you must get some good packages, and there should be an increment. So all these things we look for. So here in this field, the salary, a very good package you will be getting at the starting, at least 3.5 to 4 as a fresher. If you do have some experience, you can demand some 7, 8, 9, 10 lakhs. So I have seen people as a fresher their career with 10 lakhs of package even. So, but in general, we will be talking about it should be minimum 3.5 to 4. Okay. Then every 6 months, suppose you have joined any company, every 6 months there will be a hike in your salary. Every 6 months. Okay. Apart from that, suppose they have given 10 charts per day to solve, but you are efficient enough to solve some 20 chart, 15 chart extra. So per day, this extra chart amount will be added to your salary. Okay. Apart from that, suppose you are scheduled to work in an organization Monday to Friday, but you are available Saturday on Sunday. So if you are working on weekends, then the payment will be double of your salary. Okay, if you are working on weekends, suppose not you are not available on 4 weekends, some 2 weekends or 3 weekends you are available. You can work that. So extra payment you can generate. Okay, and there will be a hike in every 6 months. So this is what this opportunity you will be fetching. Okay, first thing is salary. Second thing we will be talking about stability. So whenever you look for any course, you should look for all the aspects, right? Why I should go for this course. So stability. Stability in the sense nowadays, no job, neither any government job also we can't assume 100% secure. Okay. But still, as it belongs to healthcare sector, so at least 40 to 50% extra stability I can definitely assure. So somebody is just scribbling on the screen. Guys, please don't do this. I request, please don't scribble in the screen. Okay. At least 40 to 50% chances of getting your like stability is more. Because healthcare is a never-ending process. As long as the human being do exist, we do have a healthcare process. We do have a coding system. Okay. So that is what I can assure you here. Third thing, we look for demand. Suppose you are looking for any course, it should have a very good demand on the market. Demand in the sense, if you take any zone of this country, either you take north, south, east, west. Guys, please go on mute. Everyone, please go on mute. Some background noise has been coming. Please go on mute, everyone. Nobody should unmute themselves. Whenever you need to ask any question, then only you have to mute. Then only you have to unmute. Otherwise, you have to. Everybody has to be on mute. Okay, because it will disturb others. Na, everybody is having their own time here. So don't disturb. Don't scribble here. Next, I was talking about demand. The jobs should be demanded. If you take any zone of the country, I'm not talking about the entire companies. I'm talking about some 2, 3 big companies. They do hire minimum of 3 to 4 times in a year. They do hire 3 to 4 times in a year. Okay. And each time they hire minimum of 500, maximum 1,000 candidates in a drive. Minimum of 500 candidates, maximum 1,000 candidates in a drive. And you cannot see below 200 people they are hiring. Okay. Every drive will be on hundreds only. 200, 300, 400, 500,000. So the drive is very high. Okay. Next, we will be talking about flexibility in the sense if you are any kind of life science candidate, any technician, any physician, any clinician, any pharma student, any like pharma background people or any nursing background people, it is a dream for this life science people to sit and work. Okay, we don't have that much flexibility. We can sit at one place because you have to go to the clinic, you have to go to the laboratory. If you see in medicine sectors, people has to stand for 8 hour, 9 hour, 12 hour in medicine manufacture industry, in industrial sectors, in laboratories. People have to stand. They have to physically work. Physical work is more in life science background people. Okay, but this is the only opportunity. This is a very good, comfortable desk job. Okay, what you need? You need a working laptop. You need a very good internet connection. You can work at your desired location, not at home. But suppose you are traveling, you are moving. Okay, so you can work easily. So that is the liberty we need nowadays, right? We can travel, we can do our own stuffs, everything. We are not bound in, we have to go to the 9 at office, come back to the 5, come back at the 8, 9, 10, like that. We have no boundaries here. Okay, suppose most of the companies nowadays preferring remote working, but whenever you're applying for the companies, you should check whether they are giving the work from home opportunity or not. So 100% all companies not, they are not giving, but few must, at least 50% companies they are offering. And nowadays what happened, they are calling for 15 days, 1 month, 2 month, 3 month to get a training, and then they are giving you opportunities because they need to train you, right? And I suggest people go and have training. What is the issue? Then you can get the work from opportunities. I do push students, if they're calling, just go for it. Go for it. 15 days, 1 month, 3 month, it is not a big deal whenever you are choosing a career. Okay, people will think, okay, 3 months I have to stay there, how I will be go, how I will be traveling. So it doesn't matter. If you are choosing a career, you have to give your 100% effort, then only if you need, because slowly all the system will be remote only. Slowly in upcoming days, remote only. If you are into this career, definitely you will get a chance. Suppose you are not getting appropriate company, but someday you will definitely get that. Okay, that will definitely happen. So next thing, what we have discussed here? First, we have discussed regarding the salary, then we have discussed regarding the stability, then demand, then flexibility. And in flexibility, one point I have to mention, if you are a trained coder and along with that you are a certified coder, then you are not confined at your place. You can work at your desired location. Okay. You suppose you want to move out of your state, you can go for that. You want to move out of the country, then also you can go for that. Okay, you are, this is a global certification. Okay, globally you can work. If you want to travel different companies, you want to explore your career in different companies, that also you can do. Okay, so neither you are confined in your state, you can work all over the India. Suppose you want to move out of the India, you want to go and work abroad. So package will be more high in abroad. So mostly the fresher candidates, I suggest them at least 2 to 3 years. You can, if you do have a time, if you know have any restriction at your own place, at your community or whatever the things, you can go abroad, you can travel, you can explore. So a lot of things you can explore in this field. And you are not confined at any place, neither in any country, neither in any state. Okay. So these are the things. Next, so what we have seen: salary, demand, flexibility, and stability. And fifth point is this job will give you a rewarding experience. What is rewarding experience? Rewarding experience in the sense every day you are putting your time here, right? Every day you are putting your time. So every day a piece of knowledge will be added to your career. A piece of knowledge. Definitely, this is a very knowledgeable field. All the medical procedure, disease diagnosis, everything you will be learning. So this is a very good platform to have a very good knowledge. Okay, and this knowledge definitely will help you in future. If you are spending a hour also in this field, definitely it will be beneficial in the further careers and further sectors wherever you want to go for any other sectors. Okay, and whenever you will be explaining this work in so and so work I have done in my career, definitely you will be praised and respected at your community, at your desired places. Okay, and very importantly, this job is a very very prestigious job. Okay, because it belongs to your healthcare job. So these are the at least 5 6 qualities we look for whenever we are choosing any kind of career, right? So I see a perfect opportunity, perfect career opportunity I can see here. And personally also I can suggest those who are really wanted to pursue this course, don't waste your time. Okay, people what they do, they think for a 1 month, 2 month, year, I wish I could have done that course. I wish I could have gone for that. So don't think all these things. If you want to take a decision and make sure you are working for it. Choose any one thing. It doesn't matter this field, wherever you want to go, choose at least one field and work for it. Definitely you will be succeeded. Okay, so these are the all aspects, all your opportunities, all these things I have explained. Next, as a coder, I hope my voice is clear to everyone. Please give a thumbs up. Please give a thumbs up. My voice is okay, screen is okay, fine, everybody is able to hear me. Give a thumbs up, everyone. Okay, thanks for the response. Next. Okay. Duration of the course. Okay, I will be coming. I have seen some text on the chat. I will be coming to those questions. Okay, let me complete this intro. Then I will be coming to your questions. Okay, so I have seen many questions in the chat section. I'll be coming to that. So next, as a medical coder, where you will be working, in which place you will be working. So you can work in hospital, doctor office, then healthcare consulting services, educational institute, insurance agencies, law firms, government agencies, and very importantly, work from home opportunities. Apart from that, from corporate companies also you can work. Okay, corporate companies also you can work. Next, we will be talking about the growth. Career growth. So career growth in the sense, suppose today you have joined as a junior coder. It is not like that for a year or 2 year, you will be like that only. Okay. You can be you can be promoted to senior coder. Okay, you can be promoted to senior coder, then quality, then review team, then you can be a team lead, you can be a manager, you can be a senior manager, then you can reach up to director level. So lot of opportunities will be here. Okay, a lot of opportunities will be here. Hmm. So next we'll be talking about. So I have told you regarding the career path. So junior to senior medical coder, senior to your quality review. You can go for any sector, administrative, management. So once you entered in this field, now there will be a lot of opportunities you can explore. Okay, there will be a lot of opportunities that you can explore. Next, I will be talking about what are the top 20 medical companies they will be hiring you after having training in this company. Okay. So after having a training in Henry and Harvard education, so there will be top 20 medical companies, top 20 renowned medical coding companies where you will be getting a chance to be placed. Okay, where you will be getting a chance to be placed. So those are will be listed here. You can see on my screen. So this will be Fusion BPO. Okay, then your Bose Healthcare, Trip Global, LDO at Iconic, GA Technocare, Nissan, Pro Mantra, Fusion Business, then your Sinoi, Access Healthcare, Medfin, Hinduja, Tech Plant, Pacific Global, InfoHub. So these are the renowned top 20 medical companies. They will be hiring you, or you will be getting a chance to have an interview with such companies. Okay. So these are the facilities you will be getting here. So any question till yet, guys? Okay. So any questions you do have, people, you can ask me. I will be here to answer your questions. Okay. So one by one question, let me see in the chat section. The first question I have received that camera. Okay. So one by one text I will be seeing in the chart section. First, duration of the course for pharmacy students. Any students you are pharmacy, nursing, physicians, chemist, or any life science background you are, or any non-life science even, the duration of the course will be 3 to 4 months. Okay, 3 to 4 months. Then internship is provided. If yes, how long will be the internship? Will the internship be offline? Internship will be provided. Yes, the answer is yes. The duration you can choose accordingly, 3 months, 6 months. That is your wish. If you are talking about offline you have to connect with your coordinator, whether online or offline, that you have to coordinate with your coordinator, that you have to interact with your coordinator. Okay. Age limit to take this course. There is no age limit. Once you are a trained, once you are certified, there is no age limit for these courses. Okay. Medical coding learning time, duration of the course. Duration depends on you. Like you have to choose your batches schedule. That duration, timings, everything you have to connect with your coordinator. Okay, they will answer for this timing, duration, whether it is regular courses per day, how many hours classes. So as for a few details I can give you, per day it can be 2 to 3 hours of classes, and duration will be 3 to 4 months. And I'm not supposed to answer here for the course fee, because I don't have that knowledge, because I'm into training. I'm just giving the training. I'm into training. So regarding training, whatever you ask me, I can answer. But course fee, anything else regarding that, you have to coordinate with your HR. Okay, through whom you join this webinar, or you can raise a request to the customer care executive, so that the respective team will be connect with you. Okay, I have 12 years of experience in medical billing. Can I switch to this now? In case, how can I expect the job opportunities? Okay, if you have a 12 years of experience, then you are in a, like, you will be most expected or a most eligible person. Okay, you will be the most eligible person as a coder. You can switch. If you want to switch, you can definitely switch, because medical billing and coding system is quite relatable. Okay, quite relatable. So that's why, no, you can, after, though you have 12 years of experience, definitely you can switch. So but I want to ask you a question. Why you want to switch? You have a very good experience. Why you want to switch? Can you put the text in the chat? Okay. Charges of the course, and it's available online. Online course. Okay, these are all online courses. Online courses. And regarding course fee, you have to connect with your HR coordinator. आई एम बी फार्मा स्टूडेंट, ये मेरा लास्ट ईयर है, क्या मैं साथ में कर सकता हूँ? Yes, definitely. I will appreciate those who are like studying and they you have decided to pursue this course. आप कर सकते हो. पढ़ाई के साथ आप कर सकते हो, आपका जब लास्ट ईयर खत्म होगा तब तक आपको जॉब मिल जाएगा, ठीक है। सो आई विल सजेस्ट कि आप कर लो, आप कर लो। उमर उमर इकबाल, यू हैव डिसाइड, इफ यू हैव डिसाइडेड, आप सेकेंड ईयर में आप +2 भी करे हो उसके बाद भी कर लो, क्योंकि प्रिपरेशन और ये में अंडरस्टैंडिंग में अगर किसी को दिक्कत हो रहा है तो दे कैन go for that. I have discontinued degree and have experience in billing almost 12 years. I want to switch, want to change it. Is this good for my future? Uh, See, if you have 12 years of experience, have you completed your degree or not, Vinod? Have you completed your degree or not? If you do have 12 years of experience in billing, and if you want to change, then you can change. There is no issues. I don't see any kind of issue in that. Okay, if you have a final year backlog. No. Final year backlog means you have to clear a degree. Otherwise, it will be because you have 12 year of experience. You are working somewhere, right? It is a very big decision. So final year, so you can pursue this course. You can pursue this course. No issues on that. There is no issue on pursuing the course. If you are certified, then it is a very good winner. But try to get your degree. Okay, try to get your degree, winner. Shruti. Okay, BZC. Okay, what this course is, Shruti? BZC. Can you just explain this qualification? Fresher in software field. बीएससी है, बीएससी, अरे बीएससी है तो आप कर सकते हो ना, यू आर मोस्ट एलिजिबल पर्सन, बीएससी, इफ यू हैव डन बीएससी. ओके ओके ओके. We know, Mr. Vinod, you can do this course. If you want to change, you can change it, but at least make sure you will be having a degree by the end of a year. Fresher in software field, yes, you can do it. I have seen 10 years of experience in as a software engineer. I have seen they are coming and working in this. Okay, because it is also a coding system, but you should have a very good knowledge on medical field. Okay, if you are not having also, you can be on training for that. Human anatomy and physiology should be very much clear, so that easily you can do it. Any other questions, guys? Telugu medium background, ma'am. Telugu medium, no issues, no issues. So you have completed, Shruti, or not? Your degree you have completed or not? Telugu medium, what's the issue? Telugu medium, there is no issue. If you have degree, what is the issue in Telugu? I completed BSc nursing in 2009. I have 1 year experience in hospital sector. Now there is 5 years gap. Now I can do. Yes, you can do it. 2019. So there is not much a gap. 5 years is not an issue. You can do. You can pursue. If you do have 1 year's experience and you are belongs to nursing, you will be the most accepted person. Okay, Jaffrey, don't worry. Go for it. You can do it well. Degree completed, Shruti. Okay, you can go for it. Thank you, mom, for this precious information. Okay, I don't have a degree. I just have a diploma in dialysis technical. Is that yes, dialysis technical. If you belongs to any other medical factor, if you have a diploma, na, you can do it. What you can do, you can go for the training. And meanwhile, some people, those who are lagging in the qualification, na, you can pursue in distance. You can pursue in distance. What is the issue? It will take hardly few years. So it is not anything has not been yet. Okay. I have BPT course. Shall I do? Please tell me. BPT course means what course you have done? BPT. Revadi, please tell your course description. Physiotherapy. Physiotherapy is the best course for this. If you have done physiotherapy, lot of physicians, they have done physiotherapy, dentists, they are all learning and get into the job roles. Okay, so if you have done physiotherapy, you are the most eligible person. BSc, MSc, PhD. Okay, don't worry for the qualification. If you have a degree, go for it. But see, I have seen one candidate that his name is Vinod. So I can suggest you, you can connect with your coordinator that you have a backlog in the degree. and you want to move for a job. So you can have a word with them. Can I get the opportunities or not? That clarification, you can have a word with the coordinator. Okay, you can have a word with the coordinator, then you can pursue go for that. Starting salary, if you are a like trained and certified coder, minimum of 3.5 lakhs per annum you will be getting. 3.5 lakhs as a fresher. But if you have a very good knowledge, if you have experience, you can demand the salary cut, this much payment I need. And after 1 year, nobody should judge this as a basic salary. Don't judge this based on the basic salary. Because after 1 year, you can demand your package. After 1 year, at least you can earn like 60, 70, 80K. Okay. So don't see the starting salary. Whenever you are switching, whenever you are going for the courses now, don't see the salary. If you're giving the 10,000, also go for it. Because I will tell you the reason. After 1 year, you can demand at least 60 to 70,000 from the same company or other company. So don't, I have seen many candidates. I have pushed many candidates to go, if they are giving 15,000, 20,000, go for it. How can I started my coding career? So Jaffrey, what's your qualification you told? I forgot actually. The text is in vanished, no? Jaffrey, I forgot your qualification. BSc Nursing. BSc Nursing you have completed now. So what you can do, you can enroll for this in Henry Harbin, this training program. You can go for this training program. Okay. You get your certificates, everything done. Then you can, they will schedule your interview for the like companies. Then you can start working there. Huh. Dimple Joshi. Okay. You want remote job now? Okay. You can contact with the HR or coordinator. You can tell, they will, after all this training and certification, they will schedule such companies, those are hiring remote works. Okay. Just before enrolling, you have to have a word with them. Yes, remote working, mostly they will be giving you. Okay, Dimple, mostly you will be getting remote work only. I don't know the path for that, ma'am. Please tell me the route way, please. Revadi. Okay. So path I will be coming to you, Revadi. Wait a second. So, Suhani, do I have to get into distance college, then join the course, or can I do it? Yes, yes, simultaneously you can do. You can do your distance degree. You can do this course. You can apply for simultaneously. You can apply for the jobs. In interview, you can tell, I'm pursuing my degree. Why you are not giving me this opportunity? Already I'm enrolled. I'm writing my exams. You can claim like that. What is the issue in there? Okay, so those who want to do simultaneous work, studying and learning, both you can do. You can study, you can complete the degree meanwhile, you can have this course meanwhile, you can prepare for the certification meanwhile. So preparation, studying, everything will need time. So by the time you can complete your degree, right? So that you can do it. Okay, so Revati, I will be telling you the career path. So just Revati, take submit your details, like what qualification it belongs to. Just text me that your qualification so that I can tell you. So you have to wait for that, Revati. Physiotherapy, yes, that already I have told you, Revati. You have, if you have done physiotherapy and 1 year experience you do have, then you can simply enroll into the course and you can have, what shall I do next step? You have to enroll Henry and Harbin Education. You have to contact with the Henry and Harbin Education. So you don't have any contact number? Contact number. Okay, wait a second, guys. I'm like asking some people to connect with you. Mm, wait a second. I thought you will be having like a contact number. Okay. So tell them I have given the number. Okay. I will be giving some numbers in the chat section, everyone. So whether it is allowed or not, I don't know. But still, I will be giving the numbers. If you want to have this course now, I'll giving a number. Wait. Just give me a minute. I will be sending the number. Ma'am, contact number. Contact number of whom, Shruti? To enroll the courses, na? Any other questions, guys? You can put me. Contact number I will be giving you, just a minute. Is degree mandatory? Can I just give a CPC exam after completion of this course? Yes, after completion of the course, you can go for CPC certification courses. So, Suhani. Yes, degree is mandatory, but officially +2 is mandatory. But it depends on the company. Sometimes they demand for the degree candidates, life science background, non-life science background. At least degree is required. So after having this training, you can go for CPC certification. That is fine, but at least you should have a degree. Placement. See, I'm not into placement. So for placement, you have to contact to the HR team. Okay. Placement is 100%. Definitely there will be a like nothing is 100% nowadays. At least I can assure you 99%. Okay. 99%. Any other text, guys? Send me. Want to know certification program. So once you enroll as a trainee, you are into training process. After training, the institute will guide you for the certification program, Dimple. Okay. Once first you have to into training. After training, you will be guided for the certification program. I have some work. I will be leaving the meeting. Thank you so much. Okay, Vinod. Okay, bye. You can leave the meet. Okay, I will be sharing the numbers. Okay, here I'm sending the number. I don't know whether I have to share it or not, but still I'm sharing as people are asking for it. 97184 97184 255 2551. So this is one number, and one more number I will be sending. That is your. Wait a second. That is your 74288 74288 74288 13009 009. Okay. Hi, Ayushi. Yes, tell me. So I have those who needed numbers I have sent, but still what you can do, you can go to the like this Henry Harbin portal. Okay, you can search Henry Harbin in the Google. You can get the customer care executive, how to enroll to the course, everything you will be getting in that. Ayushi, this side from Henry Harbin counselor. Yes, Ayushi, tell me. Yes. Revati contact details. Okay, okay. Revati, just send your contact in the chat section, Revati. Ayushi, whose details I should share if people are asking the numbers? Whose numbers I should share? Revati, just drop your number in the chat. Only share it to me. Only share it to me. Revati, drop your number. Okay. Hold on a second, guys. Let me do this first. When course is started, I am enrolled. Dimple, I didn't get. In 3 months course, the syllabus will be anatomy and physiology. No, in 3 months, human anatomy, physiology, ICD, CPT, everything will be there. Everything will be there. So it is 8438. Oops. Okay. I will like take your numbers for a second, guys. A lot of people are giving their numbers. So hold on a second. I have to take this. So guys, have a patience. Don't hesitate. I'll be clarifying all your doubts. So be on. Be here. I'll wait a second. So those who want to enroll, just give your number in the chat section. I will be taking. CPC exam is compulsory for certified medical coder. See, if you have given Umar, if you have given CPC examination, then you will be called as a CPC certified. But still, if you are not certified, then also you can work. There is no issues. You can work, you can start your work, and the company will make you CPC certified. They will sponsor your examination. No issues on that. Regarding course, you have to contact with your HR coordinator like that. Okay. Regarding your course fee, everything, you have to contact to your respective coordinator, team member, or respective department you have to connect with. Anything else, you can put it in the chat. Okay, I have sent your number, everything. So anybody else, what is the issue? Okay, now I will be coming to your issues. Yes, what other questions you do have? Possible, ma'am, Telugu medium student. Means entire degree you have done on Telugu, right, Shruti? Telugu medium. So Telugu medium is not an issue. If you do have very good communication ability in English, you can read, write, speak in English. I don't see any kind of issue in that. If you belongs to Telugu medium, I don't see any issue in that, Shruti. Revati. Okay, anything else difference between medical coding and billing? Billing, I have told you, no, billing only, this is a like, they will submit the claim process. They will make sure payment has been done or not. So this is the desk job only, billing, but they are not supposed to do the like coding and all, Jaffrey. Billing is a different department. Coding is a different. Coding, I will suggest go for coding. Jaffrey, I will suggest go for coding. Possible, na ma'am, tell you. Okay. Yes, Shruti, it is possible. Okay, any other? Is course fee included in CPT? So this CPT certification course fee, regarding course fee, kindly contact with your coordinator HR. So I'm a trainer, guys. I don't have any information regarding the like course fee and all. Anything else? If you're not having any questions, means I will wind up the session. So before that, I will be telling you, you can see, I'll show you. Suppose you have enrolled into the course. Okay. You have enrolled into the course. You can see my screen. This is a trainer portal. Okay. Wait a second. Wait a second. So here you can see the portal. This is my trainer portal. After enrolling, the same kind of portal you will be getting as a student portal. So if you scroll down the scroll bar, chapter wise notes will be present over here. And if you scroll down right at scroll bar, the soft copy of the books will be available. Okay, soft copy of the books will be available. And here you will be joining the live classes. Suppose you have missed any classes, you can go through the recording of the classes as well. Okay, so this kind of portal. And apart from that, hard copy of the book will be delivered to your address. So this is all about, guys. So anything else means you can ask me. So is the session was interesting, guys? Please give a thumbs up. You have learned something today. Please give a thumbs up. Okay, so thank you so much for your response, everyone. I can see there are no doubts yet. So I will be winding up the session. Those who want to enroll this course, what you can do, you can type Henry Harvin Education in the Google. You can access the portal. Okay. And there itself, those who are facing difficulty, but still I have texted the numbers. You can get it from the chat section. Okay. If still you are not able to fetch any person, date for what? Revati, date for what? Okay, suppose you are not fetching any persons, directly you can type Henry and Harvin Education in the Google. You can connect with the customer care executive. Okay. You can check on the site, Henry Harvin site, Revati. You can check Henry Harvin site. I think almost every day this kind of sessions is going on. You can have a demo session as well, Revati. Demo session, you can book demo sessions. I think Ayushi will coordinate with you. I have shared your number to Ayushi. She will contact you. And every day demo sessions have been going on. Those who want to attend, like how the courses are, everything, you can have a demo session. Then also you can enroll into this. Okay. And one more thing. Okay, regarding everything I have told you. Suppose nowhere you are getting contact of the institute, directly you can type like your Henry Harvin Education in the Google. You can get into the website of the Henry and Harvin Education. There itself you can book a demo, or there itself you can enroll for the courses, so that the respective team will contact you. Okay. So bye everyone. Have a great evening. So good luck for future. Bye everyone.